All right, good morning, everybody. Thank you for coming to the Innovations Theater. My name is Ryan Chamberlain. I'm the head of research and development at Subtle Medical, and I'll be showing some of our work focused on using AI to reduce dose in multiple modalities within radiology. I'll be showing examples of lowering tracer dose in PET imaging, radiation dose in fluoroscopy, and gadolinium dose in contrast-enhanced MRI. First, I'd like to introduce you a little bit to Subtle Medical. Subtle is a healthcare technology company building a suite of AI-powered software solutions that enable faster, safer, and smarter imaging across modalities. We currently have two products commercially cleared, Subtle PET and Subtle MR, that are deployed at over 400 sites worldwide. Subtle PET uses AI to enhance PET scans acquired with reduced counts, either by reducing the tracer dose or shortening the acquisition time. Subtle PET is cleared on a variety of tracers and scanners. Subtle MR. All right, is that better? All right. Subtle MR uses AI to enhance MR images acquired with shorter scan times. The acquisition times can be reduced either by reducing the number of phase encode steps, which blurs the image and requires super resolution to enhance them, or by reducing the number of averages, which increases the noise level in the images and requires denoising to enhance them. Subtle MR is cleared for use on a variety of vendors, anatomies, and pulse sequences that cover up to 99% of MR acquisitions. Today I'll be focusing on reducing dose in multiple imaging modalities. So let's discuss which types of dose we can reduce and why we would want to reduce them. The most obvious dose we want to reduce in radiology is ionizing radiation. Radiology practices have the responsibility to follow the Alera principle, making dose as low as reasonably achievable. Despite recent technological advances that can reduce the dose for a given scan, the dramatic increase in number of scans and complexity of scans is giving an overall increase in the dosage worldwide. Therefore, to slow the increasing trend of radiation dose, we need to continue to push the state-of-the-art in ultra-low dose imaging. Another dose I'll discuss is gadolinium-based contrast agents, used for contrast-enhanced MRI exams. By some estimates, gadolinium is administered in up to 40% of MR procedures. There's a growing body of literature demonstrating that GBCAs lead to long-term deposition of gadolinium in the brain, especially in pediatric patients. We do not fully understand the implications of this at this time. Therefore, it is prudent to again follow the principle of reducing dose to be as low as reasonably achievable. There is also recent work demonstrating the environmental effects of GBCAs, including gadolinium contamination within public drinking water systems. Again, it is unclear what the long-term effects of this are, but the prudent course of action would be to make every effort to minimize the amount of gadolinium being used. Another motivation to reduce contrast media usage came to light during the supply chain disruptions caused by the pandemic. This specific shortage referenced here was for iodinated contrast media for CT scans, which is not an application I'll be showing today, but similar shortages could happen in GBCAs or PET tracers. Therefore, again, it is prudent to develop technologies that reduce reliance on materials that are sensitive to manufacturing disruptions. With these innovations in mind, we at Subtle have been working on a variety of technologies that can help reduce dose across multiple modalities, including PET, fluoroscopy, and gadolinium contrast-enhanced MRI. Our team has an established track record of developing industry-leading image enhancement products through denoising, super resolution, and image enhancement and generation. However, our expertise does not stop there. To have a significant clinical impact, our technologies must undergo robust clinical validation. We regularly put our methods through multiple reader studies and peer-reviewed publications. Once our methods are validated, they must still fit into the clinical workflow to benefit patients and radiologists. So we have a team focused on optimizing our products for speed so the results can be available to the radiologist when needed, routed back to the tech while the patient is still in the scanner, or displayed real time during an intervention, depending on the application. First, I'll show you results from our commercially available version of Subtle PET. Subtle PET is deployed worldwide on over 400 scanners and uses deep learning to improve the image quality of PET acquisitions with up to a 75% reduction in counts. The image on the left shows a standard dose FDG PET, and the image on the right is that same acquisition acquired with a quarter of the dose, then enhanced with Subtle PET. Subtle PET is cleared for use on a variety of radio tracers. Here's an example of a gallium acquisition with a 50% reduction in dose. The first image is the full dose scan, the middle is the original half dose scan, and the last image shows that half dose image after being enhanced by Subtle PET. You can see the noise has been reduced while preserving the small structured details visible in the standard dose image. Here's another gallium acquisition for PSMA, this time with a 75% reduction in dose. And then here's a fluorine acquisition with 67% reduction in dose. And fluorine again going up to 75% reduction in dose. Again, you can see the small structures are preserved, not being blurred out when we do the denoising. Our commercially available version of Subtle PET has been validated in cases with up to 75% reduction in counts, but our research team is developing the models capable of going dramatically higher. Our team recently participated in an IEEE competition to enhance ultra-low-dose PET scans with up to 99% reduction in dose. Our team placed first overall in that competition. Here's one case from that competition with a 90% reduction in dose, enhanced back. And then going even further, we go to 98% reduction. At this dramatic dose reduction, you do start to see some small structures being lost, so this is an active area of research and development for our team. And then here's an example going all the way to 99% reduction of dose. Our other radiation project is focused on fluoroscopy. Fluoroscopy is a common procedure in 50 million surgeries annually in the US alone, and it can result in large radiation doses to both the patient and the clinician. Subtle recently received an NIH grant to apply our denoising methods to fluoroscopy. The primary technical obstacle for fluoroscopy is the need for extremely fast processing in order to have a real-time display during the intervention. We were able to implement our technology at 30 frames per second while maintaining high-quality images at only 25% dose. You can see here that our denoising algorithm is able to maintain the high resolution needed to visualize screw threads that are lost in the low-dose scan. And we were able to validate that this was done at real-time speeds of 30 frames per second. The final dose reduction method I'll present today is for reducing the dosage of gadolinium needed during contrast-enhanced MRI studies. This was another technology that received NIH funding to develop. Our goal was to enhance images acquired with 10% gadolinium dose to contrast levels seen in a normal dose image. The image on the left is the standard dose image, and the image on the right was acquired with only 10% of the gadolinium dose, then enhanced by subtle GAD to restore the contrast. This project is currently the focus of a clinical trial in partnership with Bayer. Here's an example of a half-dose image. Image on the left is the full contrast dose, the middle is the original half-dose image, and the right is after being enhanced by subtle GAD. You can see the small enhancing vessels that are barely visible in the half-dose image have had their contrast restored in the enhanced image on the right. And then here are similar results with a 90% reduction in the gadolinium dose. Again, the small vessel structures that you can see on the full dose scan are lost in the 10% dose scan and then restored in the enhanced image. It also is able to maintain the tumor margins that are enhanced without blurring. One more example with 90% reduction in dose. And then one more example. Again, seeing the small vessels that get lost in the 10% dose are restored on the enhanced image. We are also exploring the ability to push this technology all the way to eliminating gadolinium altogether. This slide shows some preliminary results of a fully synthetic post-contrast image created using the T2 and flare images along with the pre-contrast T1 to synthesize a post-contrast T1. This method could be used in patients where gadolinium is contraindicated, unavailable, or when the post-contrast image has severe motion artifacts that limit its interpretation. As I mentioned before, we at Subtle prioritize performing robust clinical validation studies that undergo peer review. You can find these studies in a variety of publications and are collected on our website. We also recognize the value of partnership, whether for clinical trials, deployment, or business partnerships. You can find Subtle's products on a variety of AI platforms. Thank you for coming again to the Innovations Theater. Our team is available at booth 4535 to answer any questions you may have. If you want to ask me anything specifically about research collaborations or partnerships or want to talk to me, find me afterwards, or you can email at sales@subtlemedical.com. Thank you.